We think it's often the case, not only at home but abroad, that actually organisations sometimes don't know what their training needs are. The starting point is often a bit of a self-audit to understand exactly what they need to do to raise the bar, or even initially just to understand where the bar sits in terms of how people are performing in an organisation. And what our various systems at Premier IT will do is actually help them conduct those audits and show where that initial benchmark will sit. And then, as I mentioned previously about joining up the various systems, if there are other systems, if there aren't, wonderful, we've got a blank canvas and we can provide those tools, but the tools that will enable those professions to improve their performance, and for the managers in an organisation to report on how those performances are growing and developing over time. So sometimes it's the case that they don't know perhaps what the right questions are to be asked. If they're really early on in that journey, it's just a question of knowing that there's something that could probably be improved. It might be no more than a flavour or an opinion, but we can really drill down using some quite forensic tools within the various systems, provide exactly where the needs are, where the gaps are, and then integrate with the right tools. And there may be proprietary tools, there may be others, to actually address some of those gaps. Premier IT will, if it's a brand new greenfield site, they will put in a system of software solutions that will enable you to initially self-appraise. And we can not only map to the benchmarks and the performance indicators that are out there, because that's what we've got in the UK. We've got some really strong guidelines about the questions that should be asked, but they will work universally. They're very good, not overcomplicated questions that just enable you to actually look at yourself and say, how am I doing against these various criteria? And then you'll ask your colleagues, your peers, and your patients, if you're a doctor or a nurse, how you're performing against those criteria. The answers will come back in the form of a report, and we'll join up the various elements and actions and suggest to you an online plan that enables you to improve. And if it's e-learning and training required, then there's a really nice system of blended learning that you can take part in that enable you to plug the gaps. So a brand new tool that we've got called Cortex, which is part of the Premier IT portfolio, will actually be able to integrate through a series of APIs with systems that are already out there. Often in a large organisation, and for example we'll work with BART and we work with NHS England, there are so many disparate systems that what they've got and how they communicate with each other often isn't very well understood. What we'll do at Premier IT with a system like Cortex is we'll integrate something like a learning records system, a service which enables the various elements to pull together and talk to the portal in a common language to decide exactly where people are on the journey and where their learning journey is going. And then because of the e-learning library we've got, and there are thousands of modules, we'll be able to either ourselves through those modules that we keep or through the libraries of other providers, we'll be able to provide some of the education required to keep that journey maintained. And it's very, very intuitive and easy. We always knew that if we made this journey in the least bit difficult, it would put people off, because these are very, very busy people. We get that. So it's about making it as intuitive as possible, offering variety, offering transparency in terms of what it is we're providing and where the results sit. And of course there's a reporting mechanism behind it, because the whole thing is about a kind of a global quality assurance tool that shows you that you're really doing well. And actually in the UK particularly, we are, and doctors are. So there's a very, very high pass rate, if you like. And it's not pass or fail, but there's a very high performance rate of doctors and nurses throughout the country. But they always want to get better, and our tools absolutely prove that through using the right forms of education, whether they be online or anything else, you can improve and you can prove that you're improving.